Come in.
Hi, my name's Rannie. I'm going to be your nurse today. We're going to do a head-to-toe assessment. I'm going to provide privacy. I'm going to wash my hands and gather my supplies. I'll be right back.
Okay.
So I'm washing my hands and gathering my supplies, which I'm using my phone as my pen light. Okay. Can you tell me your name and date of birth?
Kylie James, 6/20/1996.
Okay, good. Now, can you tell me where we are today and what we're doing?
We're at the hospital and we are doing a head-to-toe assessment.
Okay. Now, are you comfortable in the position you're sitting in?
Mm-hmm.
All right, well then I'm going to go ahead and get started.
Okay.
I'm going to start with your head.
Mm-hmm.
I'm checking for any bumps, bruises, or lesions, and no abnormalities to report. I'm going to go ahead and do facial sensation. You're going to close your eyes, and I'm just going to touch random parts on your face, and you're going to tell me where I'm touching, okay?
Forehead, cheek, chin.
Cranial nerve 5 is intact. Now I'm going to have you puff out your cheeks and raise your eyebrows. Cranial nerve 7 is intact. I'm going to move down to your eyes. Now I'm checking for perla. Good. Okay. Eyes are round and reacting to light. They were a 4. Her pupils were a 4 and constricted to a 2. Her sclera is white, no discharge. And I'm going to go ahead and do a couple other things, checking your cranial nerves. So you're just going to follow my finger with your eyes, and only your eyes. All right? So cranial nerve 3, 4, and 6 are intact. I'm going to do a confrontation test. You're going to cover the same eye as me, and you're just going to tell me when you see my fingers come out from behind your head. Okay.
I see them. I see them.
Okay.
I see them.
Okay. And same thing on the other side.
I see them. I see them. I see them.
Okay, cranial nerve 2 is intact. Now I'm going to move down to your nose. If you could hold one side of your nostril and sniff, and the other. Her nose is patent. I'm just going to look up your nose. Okay. She does not have any discharge. She does not have a deviated septum. And I'm going to go to her mouth. Just stick your tongue out. Okay. And can you say ah? Okay. And can you swallow for me? Okay. Her mucosa is pink, moist. And her cranial nerves 9, 10, and 12 are intact. I'm going to go ahead and go to her ears now. Looking inside her ear, there is no excess wax. I am looking behind her ears. There's no bumps, bruises, or lesions. And I'm doing the same thing on the other side. So no excess wax and no bumps, bruises, or lesions to report. Okay? Now I'm going to have you shrug your shoulders up against my hands. Okay, cranial nerve 11 is intact. I'm going to palpate her carotid artery. All right, felt that. I'm going to go ahead and do your lymph nodes, okay?
Mm-hmm.
So this is submental, submandibular, preauricular, postauricular, occipital, anterior cervical, posterior cervical, and supraclavicular. Okay? Now I'm just going to move down to your pulses. I am feeling her radial pulse for equality and rate and rhythm, and they're equal. Her cap refills are less than 3 in both her hands and her toes. I'm going to check your popliteal pulse. Dorsalis pedis, or dorsalis pedis is on your foot, and your posterior tibial. Okay. Now, can you hold your arms out? And can you push against me? Okay, push against me. And can you cross your arms? Try and hold yourself up. Okay, and try to hold yourself up. And with your legs, can you try and resist against me? Okay, and resist against me. Okay, strength is good in both lower and upper extremities. I'm going to go ahead and go to your heart now. So, second intercostal space, right to the sternal border is arterial, or apical. Second intercostal space, left to the sternal border is papillary. Third intercostal space is herbs. Fourth intercostal spacing, left to the sternal border is tricuspid. Fifth intercostal space, midclavicular line, is mitral. And now I'm just going to listen to her lungs. Can you take a deep breath for me? And a deep breath. And a deep breath. Deep breath. And deep breath. Deep breath. Okay. Now her thorax size is anterior to posterior to lateral is 2 to 1. And I'm going to go ahead and have her turn around. And I'm going to listen to her lung sounds on her back. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Okay. Now I'm checking her thoracic expansion. Can you take a deep breath? Okay, good. Now I'm doing vocal firmitis. I'm going to move my hands down your back, and all you're going to do is say 99, 99 until you feel me get to the bottom, okay?
99, 99, 99, 99.
Okay, good. Now I'm going to have you, if you would, lay down on your back. And I'm going to lift your shirt up. And right now I'm just inspecting. There's no scars, bruises, or lesions, or tattoos anywhere on her stomach. I'm going to go ahead and listen in all 4 quadrants. So, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Vowel sounds are present in all 4 quadrants. Can you tell me your bowel habits? Are you having normal bowel movement throughout the week?
Yes.
No pain when you go?
Nope.
And your last bowel movement?
This morning.
Okay, this morning. And your last void?
This morning.
Also this morning. Any pain or irritation whenever you go?
Nope.
Okay, good. Now I'm going to go ahead, I'm going to palpate, and you just tell me if you have any tenderness in any of these areas. So I'm palpating the right lower quadrant.
Nope.
No tenderness? Okay. Right upper quadrant.
Nope.
Left upper quadrant.
Nope.
And left lower quadrant.
Nope.
So no tenderness in all 4 quadrants. And I'm going to go ahead and put her shirt down. I'll have you sit back up if you would. And I'm going to do do her reflexes real fast. scoop in my ear. Sorry. Now I'm gonna go ahead and check her tricep. Okay. And I'm doing her bicep now. Okay. And her brachial arterial. Okay. And I'm going to go ahead and do her tricep on this side. Bicep. I'm going to do her brachial arterial. Okay. I'm doing her patellar reflex. And in this leg. Okay. Now I'm doing her Achilles. Okay. And I'm going to have you stand up for me and walk to the door and walk back for me. Okay, good. I'm going to have you close your eyes. I'm doing what's called a Romberg test. And a little swaying, but that's normal. Okay. And can you sit back down for me? I'm going to have you do range of motion in your arms. If you could just flex your arm in, flex it back out, and turn it. Okay. And same with the other arm. Good. And your foot. Out and in, and then just a little circle. Out and in, and a little circle. Okay, good. I'm going to do ankle conus. Any tenderness in your calf when I do this?
No.
And check the upper leg.
No.
No? I'm going to do a Babinski reflex or plantar. Okay, that's normal. Okay, and I'm just taking a look at everything I did. I think that everything is good. My name is Rannie. Once again, I'm your nurse today. Here's your call light.
Thank you.
Okay, and if you need anything, just go ahead and give me a call. I'm going to wash my hands, document, and I'll be back to check on you in an hour, okay?
Thank you.
Alrighty.